Hello, I'm Lizbeth Vasquez, and I worked with the LatinX Health Action Network in conjunction with a couple different agencies to create this document named the Communication Analysis and Strategy Recommendations. During this internship, I was tasked with creating a document to assess the current public health emergency lines of communication for the Latinx community in Washoe County. I also worked with different organizations in a Health and All Policies Advisory Board to recommend these changes. We also look to create an improved communication strategy working with different stakeholders. This collaboration was vital to ensure that the correct public health information is disseminated to the Latinx community in case of another public health emergency, such as the COVID-19 pandemic. So according to the 2019 Health Needs Assessment of Nevada, 1/3 of Nevada's population was stated to be Hispanic or Latinx, and this continues to increase. There are existing health disparities among the Latinx population, causing specific barriers to be disproportionately affected during this pandemic. About 40% of positive COVID-19 cases came from Nevada's Latinx population, as seen on this chart on the left. Some methods to gather these findings included the outline of any current communication strategies and how they're being translated and the verbiage used, analyses of the Department of Health and Human Services COVID-19 dashboard that reports confirmed cases and testing by demographic, results from a faith-based survey done by the Nevada Public Health Training Center about messaging, and conducting a gap analysis of the communication line in place to create further recommendations for this population. Based on research, there were 7 recommendations to find approaches to addressing different communication disparities for this community. These are mentioned here, including understanding language and proportion, health literacy, and adequate modes of communication. This information was used to create 2 info charts showing the modes of communication that can be available and an order of communication, which would include properly translated documents, taking into account health literacy and different dialects within the Latin community. After this information was gathered, I constructed a phased approach to messaging to the Latinx community. This will also be updated continuously to include direct information as needs assessments are done on the community. Outcomes of this pilot project also include its addition to become a bill draft request as an add-on to Senate Bill 302 and Nevada Revised Statutes 656A100 and 110. This document aided in requesting a Nevada state translator or team that would aid in response to this magnitude of an issue. They would implement culturally and linguistically appropriate service standards and approve a set language access for vital documentation and other identified areas for translation. Thank you. If you have any questions, just email me at lvasquez@unr.edu. I would also like to take this time to thank my preceptors, Baldo and Tammy from the Nevada Public Health Training Center. I would also like to thank the Office of Minority Health and Equity, the Western Region Public Health Training Center, the Latino Research Center, Community Health Alliance, the Washoe County Health District, and the City of Reno for providing support on this project. I will also be acknowledging our consultation panel and our Health and All Policies Advisory Board. Thank you.